Discover a new technique to treat obesity without surgery. Until now, treatments for severe or morbid obesity have involved delicate, risky surgeries. Other treatments, such as the intragastric balloon approach, involve a lot of personal and psychological investment. However, a new therapy has been approved, and it's working well. This approach can help solve some of the problems associated with morbid obesity. It's known as the Aspire Assist system, which looks quite simple, and it seeks to reduce the number of calories that the body absorbs. The best part about it is that there's not need for surgery. Today, we'll give you all the information about it. A new treatment for patients with severe obesity. Severe or morbid obesity is when a person has a body mass index, BMI, of greater than 40. Being this overweight considerably limits their quality of life. In addition, it can cause serious diseases that can lead to death at a very young age. The causes of morbid obesity. Morbid obesity isn't just a product of overeating, a lack of willpower, or simply using food as an emotional crutch. Scientific research tells us that several factors typically come together in these cases. Genetics certainly play a key role. This is what can cause a person who is dieting and getting exercise to still struggle to lose weight, for example. Metabolism is another aspect to keep in mind. Your environment, education, and certain diseases are other important taxes. Experts also say that there is a theory known as set point. By this they mean that the brain has a kind of thermostat that causes certain people to be more prone to weight gain than others. Let's take a look at an example. If you decide to restrict your caloric intake, your brain will respond by lowering your metabolism. You might lose weight for a few weeks, but soon you'll regain those lost pounds. This is your body's set point. A new approach for treating obesity. aDiscover Medical Laboratory. It operates based on the following principles. Aspire Assist is a bypass. A doctor applies it to the stomach through an endoscopic procedure, a small silicone tube. The silicone tube acts as a port between the stomach and outside the body to serve as an access point. This port, or stoma, measures just 2 centimeters in diameter and is not visible or annoying. Its purpose is as follows: the patient can remove food they ate that is being stored in their stomach. Aspire Assist absorbs around 30 of the food contained in the stomach. It is able to calculate the right amount that should be removed so that the patient will later only absorb the appropriate number of calories during later digestion. The device also has a safety feature. The patient can never increase the number by themselves. However, this procedure is not useful if it isn't a part of a program that involves monitoring and control. This is very important to remember. Patients must return to a medical facility to continue to operate the device and to ensure that their health and safety is on the right track. What patients should know about this new technique. Surgeries and post-operative care can be very sensitive, and not all morbidly obese patients can undergo these procedures. It's important to remember, however, that this method of food removal is not the solution to being severely or morbidly obese, it's a tool. The advantage lies in the fact that it's easy to apply and the side effects are minimal, but without personal responsibility, it's of no use whatsoever. In addition, certain factors should be taken into account. The patient should be part of a rigorous medical monitoring and control program. It will help them improve their eating habits and lifestyle. The procedure will last for 5 years. After that time, and once the patient achieves the correct weight, they will stop using aSpire Assist to maintain and consolidate those new habits. As you can see, science and medicine remain committed to responding to a public health crisis as severe as obesity.